So one is I'll also speak about the science, and then tell you about my experience with my patients. So while we dietitians are planning, so there's a lot that goes into meal planning. It's just not something like a sheet of paper that we give. Obviously, there's a lot of thought process that goes into planning. And when we're looking at obesity management, glycemic control, definitely one is to try and help the person achieve faster satiety, looking at the dietary fiber, the resistance starch, and I think Ishi as well as Dr. Vinod have spoken about it. And when we're looking at cutting calories, especially when it comes to pre-diabetes, and today we're talking about remission of diabetes, and we're looking at, cutting down calories and a low-calorie, carb-controlled diet, we still have to give adequate nutrition. So it has to be nutrient dense. We have to look whether it's a low to moderate GI, low to moderate glycemic index. So there's a lot of thought process that goes when we are planning the diets and the ingredients that we are going to put in. And when it comes to the jackfruit flour, we all know about this. So when we're looking at 200 grams of rice flour or 200 grams of wheat flour, and the corresponding amount of the jackfruit flour, so 30 grams of jackfruit flour replaces 50 grams of wheat, rice, or millet flour because of the isovolume effect, the low bulk density of the jackfruit flour. And again, this is something that has been highlighted by Dr. Vinod as well as Ishi. So basically, if you look at this, even for 30 grams of jackfruit flour versus 50 grams of wheat flour, millet flour, rice flour, the amount of soluble fiber is even more higher, even for a smaller volume. So for 30 grams, you're having 1.65 grams of soluble fiber versus zero point 0.8 which is there in wheat flour, 1.2 in your millet flour, and 0.5 in rice flour. And when we're looking at glycemic index and glycemic load, now, we have a list of, glycemic index of different foods. And when we're looking at GI, whether it's a bajra roti, because everybody with diabetes or, people wanting to lose weight, they would switch to having a millet roti, thinking it is low in carbs, it is low in calories, and they would have the same amount or even more at times. And if you look at the GI of a bajra roti, it's around 67. A maize roti is around 64, and you have all the different varieties, the recipes of your Indian foods. But whereas if you look at your jackfruit flour, it has got a GI of around 65 and a glycemic load of 17. So it's basically a moderate GI, moderate GL. But what is really striking it has high amylose content, and we know that high amylose makes the GI lower, and also type 2 resistant starch and a good prebiotic. And today we're all talking about prebiotic and probiotics. So even when we're planning a diet, we're trying to give foods which are natural prebiotics, because gut health has become a very, very big thing, and we know the importance of having good gut health. Now, we all do CGMS for our patients. I'm just going to share with you one CGM data of a patient. So this is how week 1 looked when the person was having, the wheat roti and the millet roti. And then when you shifted them with, adding 30 grams of jackfruit flour to the diet, and this is how the blood glucose levels are, improving. And this is what we see with our patients. In fact, they say that when they were eating 3 rotis, now they're eating only 2, because the satiety is achieved much faster. And the postprandial blood glucose levels are definitely much better. So where we're seeing a PP of around 180 or 200, now the PP blood glucose levels are in the range of 140, 130. And they feel so happy and motivated that just one change about just adding jackfruit flour to their regular meal has brought about an improvement in their blood glucose response. Now, this is a very interesting study where they actually try to incorporate jackfruit into different recipes. So, either as a chapati, so 100% as chapati or a puttu or an idiyappam, and 50% you're adding to idli, or 25% of jackfruit flour adding to appam, dosa, porridge, and upma. And they tried to do an assessment in terms of what is the kind of acceptability in terms of taste. And chapati had the highest score. So, and we all know, and our patients have been using it for their chapati. Rice appam had moderate acceptability, whereas upma had a lower score. So, at least when it comes to the recipe, so you don't have to just confine it to having, only for the chapatis. In fact, our patients added to their idli dosa batter. And some of us are, even including me, and I've had this conversation and discussion with you, is we actually just mix it with regular just curd and have it with meals. And I tell my patients to do this, before the meal. So, you add one tablespoon of jackfruit flour to a cup of curd and have it, and then you have the meal. So one is that you're adding fiber, and we know the food order. So, adding fiber and protein to a meal and beginning your meal with fiber and protein helps to blunt the post glycemic blood glucose response and also achieves better satiety. And this is what our patients have been doing. So, one is improved gut health, second is early satiety, so calorie restriction, and also better postprandial blood glucose responses. So, this is something that is really working well with our patients, whether it's adults as well as children. We've been using it even in children, and we've seen very good results. In fact, the parents of children are really surprised because the amount of insulin required is also going down. And that's a huge motivation for the children as well as for the parents. And that has only motivated me to, prescribe it more to our people. And especially when it comes to weight loss, I think people are looking for satiety and something which is not, going to change the taste of the product. Very, very important, because I think we are all wanting tasty food. So you add something which is not going to change the taste or the flavor of the food, and this is what fits in really beautifully. And this is a little feedback from some of our patients who've been using it. So the first thing, I've just copied it as it is. So no distinct taste is the first feedback. So our parents are very happy when it comes to children. Even the adults who are using it are very happy because they can just add it to curd or just add it to the dal or to the rotis. Weight loss, early satiety, and improved postprandial blood glucose responses. So this is what is in my clinical experience with my patients, and I've also been using it. And honestly, it's done a world of a difference to our practice. Thank you.